Hello. This video will cover key instructions for using the Prevena Restor Incision Management System. This video is intended for healthcare professionals. The Prevena Restor Incision Management System is indicated for the management of closed surgical incisions that continue to drain following sutured or stapled closure, by maintaining a closed environment and removing exudate via the application of negative pressure wound therapy. Prior to use, consult detailed product indications, safety information, and instructions contained in the Clinician guide provided in the dressing cartons and system kit. First, let's cover some important safety information. This video will cover 3 important topics: how to apply the Prevena Restor Incision Management System, how to connect to a VAC therapy unit, and how to correct a leak condition on the Prevena Restor Incision Management System. Let's begin with our first section: how to apply the Prevena Restor Incision Management System. Before you apply the dressing, prepare the site with these steps. Surgical drains must be routed under the skin beyond the boundary of the Prevena Restor dressing. The Prevena Restor system includes multiple configurations and sizes of precision-designed dressings to be chosen based on the desired coverage area. Each dressing is single-use and disposable. This video demonstrates one application example for the Roto form dressing. The Prevena Restor system can be applied over most sutured or stapled incisions and is suitable for a variety of anatomical locations. First, measure the incision and choose the appropriate Prevena Restor Incision Management System kit based on the desired coverage area. Then use aseptic technique to open the sterile dressing package and remove the dressing and patch strips. Do not use if the package has been torn or the sterile seal has been compromised. Next, gently peel back one release liner on the back of the dressing to expose the adhesive. Center and apply the dressing over the closed wound or incision, ensuring that the adhesive does not contact or cover the surgical closure. Orient the dressing on the patient to eliminate sharp bends or kinks in the tubing. Do not pull or stretch the dressing before it adheres to the skin. Remove the remaining release liner by grasping the tab and gently pulling. Firmly press around the dressing to ensure a good seal where the adhesive contacts the skin. Once you ensure the seal, remove the top stabilization layers. Next, you'll connect the dressing to the 14-day Prevena Plus 125 therapy unit that comes with the Prevena Restor System kit. Remove the canister from the sterile package and insert it into the Prevena Plus 125 therapy unit. Slide the bottom of the canister into the slot on the bottom of the therapy unit and close the canister against the therapy unit. Connect the Prevena Plus connector to the canister by plugging the connector onto the tubing ports on the side of the canister. Push them firmly together. Connect and lock the dressing tubing to the Prevena Plus connector by pushing the connectors together and then twisting them. Now you're ready to begin therapy by pressing and holding the on-off button for 3 seconds. The green lights on the front of the unit will illuminate, indicating that therapy is on. With therapy on, be sure to assess the dressing to ensure integrity of the seal. The dressing should have a wrinkled appearance, and the foam bolster should be compressed. If there is any evidence of a leak, check the dressing seals, tubing connectors, and canister connection. To interrupt therapy or turn the unit off, press and hold the center of the on-off button for 3 seconds. Let's now move to our second section, how to connect to a VAC therapy unit. Prevena dressings can be connected directly to a VAC therapy unit. These units consist of ActiVac, VAC RX4, and VAC Ultra therapy units. The VAC Ultra and VAC RX4 therapy units are only indicated for use in acute care setting. Before transitioning the patient to home care, this therapy unit must be replaced with one for home use, such as the Prevena Plus 125 or ActiVac therapy unit. Start by inserting the canister into the VAC therapy unit. Connect the Prevena Restor dressing tubing to the VAC therapy unit canister tubing by pushing and twisting the connectors to lock. Ensure that the clamp on the canister tubing is open. Set VAC therapy unit at -125 mm of mercury, continuous, and activate the system. Do not choose any other negative pressure setting or intermittent or dynamic pressure control therapy modes of negative pressure. Finally, begin therapy. Let's now move to our final section, how to correct a leak condition on the Prevena Restor Incision Management System. If there is a leak around the dressing, a solid yellow LED will turn on above the leak symbol on the device. The leak alert will sound 2 beeps, repeating every 15 seconds. To correct a leak on the Prevena Restor Incision Management System and create an adequate seal, follow these steps. First, with the therapy unit on, slowly press firmly around all dressing edges to ensure there's good contact between the adhesive and the skin. Use your fingers to smooth out wrinkles or creases. If you identify a leak, use Prevena patch strips, which can be found in the dressing package to help seal them. If large wrinkles are present, place the patch strips so they run in line along the length of the wrinkle and not across the wrinkle. Ensure that the canister is securely locked onto the therapy unit. Check to make sure the dressing tubing is properly connected to the canister. Check the tubing connectors to ensure they are fully engaged and locked. Note: upon correcting a leak condition, a small delay will occur before the therapy unit senses the correction and silences the alerts. To avoid tension or irritation on intact skin, it is recommended that you use Prevena patch strips under the Prevena dressing for protection.